Did you know that sudden cardiac death doesn't always come with a sign or a warning? While some people may feel chest pain, shortness of breath, or dizziness before their heart stops, many others experience no symptoms at all. No warning, no second chance. According to Johns Hopkins Medicine, this is exactly what makes sudden cardiac arrest so deadly. And that's why we had to make a video like this, to bring awareness to something that can be prevented, yet is rarely talked about. In today's video, you're going to discover the shocking connection between magnesium deficiency and sudden cardiac death. How this common mineral silently controls your heartbeat rhythm and blood pressure, the foods and supplements that can restore your magnesium levels safely, and how to know if you're at risk before it's too late. Because here's the truth. Up to 75% of people are unknowingly deficient in magnesium, and you might be one of them. So please, like this video and subscribe to the channel if you haven't already. It helps this vital information reach more people, maybe even save a life. Let's begin. Every single year, sudden cardiac death, SCD, claims the lives of over 300,000 people in the United States alone. That's nearly 1,000 unexpected deaths per day, often striking without any obvious warning signs. Now here's what's truly shocking. A 2006 study published in the American Journal of Clinical Nutrition revealed that individuals with the lowest blood magnesium levels had a 2.07 times higher risk of sudden cardiac death compared to those with the highest levels. In other words, low magnesium doubled the risk, and this wasn't a small study. Researchers followed over 88,000 women from the Nurses' Health Study for 26 years, making this one of the largest and longest studies on magnesium and heart health ever conducted. But this isn't the only study painting a dire picture. A 2011 study in Circulation found that each 0.25 milligram per deciliter decrease in serum magnesium was linked to a 33% higher risk of sudden cardiac death in middle-aged adults. What's even more concerning is that many of these individuals had magnesium levels still considered normal by standard lab tests, suggesting that what we call normal might not be optimal. Another Framingham Heart Study analysis discovered that lower magnesium intake was associated with an increased risk of atrial fibrillation, AFib, a major risk factor for stroke and sudden cardiac events. What magnesium does for your heart? Magnesium isn't just another mineral you need in small amounts, it's a vital electrolyte that directly controls your heartbeat. It plays a crucial role in regulating the electrical impulses that keep your heart rhythm steady and consistent. Think of it as the body's natural pacemaker assistant. Without enough magnesium, the heart's finely tuned electrical system can go haywire. When magnesium levels drop too low, your heart can begin to experience dangerous arrhythmias, irregular heartbeats that can sometimes be fatal. Blood vessels may also begin to tighten and constrict, which puts additional pressure on the heart and leads to elevated blood pressure. At the cellular level, a deficiency allows calcium to flood uncontrollably into heart cells, which triggers inflammation and increases the risk of abnormal contractions. And perhaps most alarming of all, low magnesium levels dramatically raise the risk of fatal heart rhythm disturbances, such as ventricular fibrillation, a chaotic rapid heartbeat that often leads to sudden cardiac death if not immediately treated. Here's something many people overlook. Your heart is a muscle, and just like any muscle in the body, it needs magnesium to relax properly after each contraction. Without enough magnesium, the heart can't rest. It can spasm, misfire, or simply give out. That's why maintaining healthy magnesium levels isn't optional, it's absolutely essential for life. What causes magnesium deficiency? Here's the real danger that most people don't realize. You can be deficient in magnesium even if you eat what seems like a healthy diet. You could be loading your plate with vegetables, whole grains, and other clean foods, and still fall short. Why does this happen? One of the biggest reasons is that modern farming practices have quietly robbed our food of its natural magnesium content. Over the past century, aggressive soil depletion, thanks to industrial agriculture and over-farming, has drastically reduced the mineral content of our crops. A 2011 study published in the Food and Nutrition Bulletin found that the magnesium levels in vegetables have declined by anywhere from 20% to 80% compared to a century ago. That means the spinach or broccoli you're eating today might contain only a fraction of the magnesium it once did, but that's just the beginning. Most modern diets are also flooded with processed foods, which are stripped of almost all natural magnesium. High sugar intake, something incredibly common in today's world, actually forces the body to excrete magnesium through the urine, making matters worse. Then there's the widespread use of diuretics, often prescribed for blood pressure or heart failure, which cause additional magnesium loss. Chronic stress further depletes magnesium by activating your body's stress hormones, which increase urinary excretion. And common daily habits like alcohol consumption and excessive caffeine intake can leach magnesium from your system as well. Even some medications are culprits. Proton pump inhibitors, PPIs, drugs often used for acid reflux, along with certain antibiotics and other medications, can interfere with the body's ability to absorb or retain magnesium. When you add all of this together, you get a perfect storm for widespread magnesium deficiency, even among people who believe they're eating well and taking care of their health. Who's most at risk? So who should really be concerned about magnesium deficiency? Older adults are one of the most vulnerable groups. As we age, our bodies naturally absorb less magnesium from food, while simultaneously losing more through the kidneys. This means that even with the same diet, an older person may have significantly lower magnesium levels than someone younger. People with diabetes are also at high risk. When blood sugar levels are elevated, the body tries to flush out the excess glucose through the urine, and along with it goes magnesium. Over time, this constant loss can leave the body depleted, even if magnesium intake appears normal. Those with heart disease, high blood pressure, or kidney problems should be especially cautious. These conditions not only increase the body's demand for magnesium, but many of the medications used to manage them, such as diuretics, further deplete magnesium stores. Surprisingly, even athletes and active individuals are at risk. Why? Because magnesium is lost through sweat. So, the more you train or the hotter your environment, the more magnesium your body loses, especially if you're not consciously replenishing it. What's most alarming is that even a mild magnesium deficiency can begin to affect your heart. People often report symptoms like heart palpitations, tightness in the chest, unexplained fatigue, muscle cramps, or anxiety, all early signs that your cardiovascular system may be under stress. The good news? Once you understand who's at risk and what the signs are, you can start taking action, and possibly protect your heart from something as serious as a fatal arrhythmia. How much magnesium do you need? So how much magnesium do you really need to protect your heart and support overall health? According to the RDA, the recommended daily allowance, adult women should aim for 310 to 320 milligrams per day, while adult men should get around 400 to 420 milligrams daily. These numbers represent the bare minimum needed to prevent outright deficiency. But here's the catch. Those numbers may not be enough for optimal health, especially when it comes to protecting your heart. Many nutrition experts and cardiologists now believe that true cardiovascular protection may require closer to 500 milligrams or more per day, particularly for people at higher risk, such as older adults, diabetics, or those with hypertension, kidney disease, or chronic stress. Unfortunately, the average person only gets around 200 to 250 milligrams of magnesium per day from food, according to national dietary surveys. That's barely half of the recommended minimum, let alone what's considered optimal for heart health. Best sources of magnesium. Let's fix the problem by looking at where you can actually get more magnesium, starting with your plate. Some of the best natural sources of magnesium are foods you may already enjoy. Spinach and other dark leafy greens are incredibly rich in magnesium and also packed with other heart-healthy nutrients. Nuts and seeds, especially almonds, cashews, and pumpkin seeds, offer a powerful magnesium boost in just a small handful. Fatty fish like mackerel and salmon are also excellent sources, giving you not only magnesium but anti-inflammatory omega-3 fats, which are also great for the heart. Surprisingly, dark chocolate is another magnesium-rich food, as long as it's 70% cocoa or higher. A square or two a day can be a guilt-free way to help meet your magnesium needs. But like we said, even with the best diet, some people still struggle to meet their magnesium needs, especially those with absorption issues or higher physiological demands, like older adults, diabetics, or athletes. That's where magnesium supplements can come in handy. Some of the most effective and bioavailable forms include magnesium glycinate, which is gentle on the stomach and calming for the nervous system, magnesium citrate, which is well absorbed and often used to relieve constipation, and magnesium taurate, which is specifically beneficial for heart health due to its synergy with the amino acid taurine. One important tip: avoid cheap or poorly absorbed forms like magnesium oxide. While they may look like a bargain on the label, they offer very little actual absorption, meaning your body can't use most of what you're taking. Choosing the right sources, both from food and, if necessary, supplements, can make all the difference in restoring your magnesium levels and protecting your heart for the long run. Sudden cardiac death rarely gives a second chance, but magnesium deficiency might be the warning sign you need to pay attention to. And the best part? It's one you can actually do something about. So take the step today. Fix your diet, supplement smartly, and above all, protect your heart, the one muscle that never takes a break. And here's a critical note. If you're currently taking medications, especially diuretics, blood pressure meds, or proton pump inhibitors, or if you have kidney disease, you should talk to your doctor before starting magnesium supplements. In some cases, impaired kidney function can make it difficult for the body to regulate magnesium levels, and taking too much could be harmful. If this video opened your eyes, don't forget to hit that like button, subscribe for more life-saving insights, and share this with someone you care about. Because the truth is, you just might save a life. Thanks for watching, and take care of your heart.